Good afternoon, everybody. Welcome to the City of Toronto's COVID-19 media briefing for Friday, May the 1st, 2020. With us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor?
Thank you, Brad, and good afternoon. Today is First Responders Day, so I want to begin by recognizing the amazing work that our first responders, whether it be the paramedics, the firefighters, the police officers, and our 911 operators, who are unsung heroes as well. All of those people do an incredible job on a daily basis across our city, and in particular, of course, during these last 7 weeks as they've joined all of us in the fight against COVID-19. It is also today, the same day, Doctors' Day, and that's a day to recognize the commitment and contributions of our doctors, including the doctor seated to my right, our Medical Officer of Health. But we are thankful, I think now more than ever, to our doctors, along with all of our healthcare workers who have been working so hard on the front lines during the COVID-19 pandemic. Their commitment to fighting this battle has helped our country and our city during the worst of the days so far. Now, as many of you will have remarked, while people across the city are listening to and accepting, as I do, the very best public health advice that we can get, which is to stay home and only venture out for essentials when absolutely necessary, people are accepting that, and this has resulted in considerably fewer people being out and about in our city, thank goodness, because it's contributing to stopping the spread. We cannot thank enough all of the residents who are following Dr. de Villa's advice and staying home as much as possible. And while I recognize that a lot of this reduced activity stems from bad news, the virus itself, the shutdown, the lost business, the lost jobs, it does at the same time present us with an opportunity. With traffic volumes down between 45 and 66%, and we have extensive technological measurement of this now available on many city streets, this presents an unprecedented opportunity for us to accelerate as many of the city's major planned construction projects as possible as we kick off our summer construction season, to get the work done while things are quieter and to get some projects done before things get busier again. By taking a bold and aggressive approach to construction this year, we will ensure that the vital infrastructure that is used by millions of people in Toronto every day will remain safe, in a state of good repair, and as ready as possible for when the restart and recovery begins, hopefully not too long into the future. This kind of construction is considered an essential service by the province of Ontario, and by continuing with the city's planned projects, it will provide important opportunities to support the local and provincial economy and the construction industry. And of course, our construction workers in many cases have been on the job throughout this entire pandemic. This will enable crews, drivers, suppliers, and others in the industry, as it has done in some cases, to continue to work during this period of time, always in a safe environment which respects public health imperatives. This year, the city will both start new projects and complete 2019 work, which will bring some level of construction to more than 550 streets across Toronto. This work will make repairs to Toronto's major and local roads, sidewalk and cycling infrastructure, improve public transit infrastructure, replace and rehabilitate water mains and sewers, and build and improve major water infrastructure that will in turn help to improve Toronto's waterways and stormwater systems. I've asked city staff to work to accelerate as many projects as possible, making our roads available for construction, alleviating restrictions on roads and intersections during peak and off-peak hours, and working with contractors on means and methods they can take to complete these projects within a fast-track schedule. Now is the time to accelerate and move forward more rapidly with fewer restrictions on these projects. Some of the major projects that will be accelerated include Bathurst Street from Front Street West to Fort York Boulevard, where bridge rehabilitation, TTC track rehabilitation will result in a full road closure starting May 17th. The replacement of a 143-year-old water main on Bathurst Street from Front West to Queen West, replacing a 143-year-old water main and TTC track requiring a full intersection closure on Church Street at Richmond, rehabilitating the Don Mills Bridge over the Don Valley Parkway, and completing the replacement of a 146-year-old water main on Richmond Street from York to Bathurst. In addition, other projects that the city is now looking to accelerate this spring through working with the contractors and advancing the tender process because of the quieter traffic conditions include road reconstruction and water service replacement on Midland Avenue from Danforth to Lawrence, road resurfacing, sidewalk and curb construction on Martin Grove from Finch to Albion, road reconstruction, sidewalk construction, and upgrading cycling infrastructure on Shooter from Sherbourne to River, replacement of a 140-year-old water main on Bathurst from Front to Queen West, replacing a 131-year-old water main on Ossington Avenue from DuPont to Bloor Street West. This is just a sampling of the significant projects that we can hopefully get much more of done during a time when you are not using the roadways and therefore interfering much less with traffic, which hopefully can return more to normal when the economy reopens. The city is also continuing our program of maintenance on bikeways and on sidewalks and roads to keep our infrastructure safe. City crews are also making daily pothole repairs with more than 12,000 potholes fixed in April despite physical distancing restrictions. We'll be putting the hurry up on potholes this month on both streets and bike lanes. Beyond the daily repairs, pothole blitzes are planned throughout May, starting with one tomorrow, Saturday. Crews are also planning annual spring maintenance on the Gardner Expressway at the end of this month. Better to do it now than later. Since March, when reduced emergency period traffic levels began to decline, the city's work zone coordination team has been actively meeting with private contractors and utility companies to help accelerate their work by approving 600 rush hour exemptions and extending work hours, which also supports worker safety. And while we have ambitious plans to make the most of lower traffic volumes, we recognize the challenges that COVID-19 presents to the construction industry and to workers in terms of keeping them safe and healthy. The city continues to be committed to working with the industry and with the unions to ensure contractors adhere to public health guidance for the health and safety of all workers. This is another example of common sense action that the city is taking during the COVID-19 crisis to help as much as we can. The work has to get done, and now is the time to get as much of it done as we possibly can while traffic levels are reduced. This is both sensible and safer. And while you continue to adhere to the advice to stay home, I am committed to getting this work done on your behalf and getting it done as quickly as possible so that it is ready for all of our residents and businesses when we come out on the other side of COVID-19. Along with the work underway right now to address sidewalk hotspots through Curb TO, I've asked city staff to look at more active transportation as a crucial part of the restart and recovery. Our streets are going to look different in many places in the post-COVID world. And I want to thank City Council for unanimously supporting this view yesterday. The General Manager of Transportation Services and the Medical Officer of Health were asked to pursue opportunities together to provide, where possible, and under the advice of public health and through the citywide recovery planning process, more space for pedestrians, cyclists, and transit riders to allow for better physical distancing. Council also asked Transportation Services to report back on the possibility of fast-tracking projects within the 10-year capital plan for both Vision Zero, our pedestrian and cyclist safety program, and for cycling infrastructure itself. While it isn't my favorite part of being mayor by any means, this emergency situation is changing the way we do many things, including for this year, how we will celebrate Canada's birthday. It falls upon me to share the sad but I believe sensible news with you about Canada Day in Toronto in 2020. And we're one of the latter communities to reach this unfortunate conclusion as opposed to one of the first. Based on the recommendation of our Medical Officer of Health and so as to stop the spread of COVID-19 and save lives, the city will be promoting participation in national virtual Canada Day celebrations. And this will also mean, of necessity, cancellation of all city-led and city-permitted Canada Day events, including fireworks at Ashbridge's Bay, Centennial Park, Milliken Park, Wadlow Park, and Weston Lions Park, Canada Day celebrations at Mel Lastman Square, Scarborough's annual Canada Day event, the Centennial Park Canada Day celebration, and the East York Canada Day Parade and Festival. Believe me, I am as disappointed as you are about the cancellation of these events. I would like nothing more than to tell you that we can celebrate the birthday of our great country as we usually do with friends and family in many of the usual places, but we just can't this year out of caution and out of an overriding concern for public health. Instead of these traditional in-person events, the city will join with cities and communities across Canada to celebrate a virtual Canada Day on July the 1st. We will be working with the many community and cultural organizations who we traditionally partner with to celebrate our nation's birthday and to plan virtual Canada Day celebrations that will showcase Toronto, including tributes to our frontline workers in the fight against COVID-19. We will announce more details about the virtual celebrations in the coming weeks. I encourage residents to show their support and their love for our great country, Canada, in real life. Decorate your porches, decorate your balconies, wave your flags, decorate your front doors with a flag. There are ways in which we can show our love for our country in this year where we won't be able to be together as much. Wherever people are in the city, I would love to see them with Canadian flags everywhere, celebrating our united effort as a country to confront and defeat COVID-19. So I look forward to celebrating virtually with Toronto residents on July the 1st, but even more, I look forward, as I'm sure you do, to the day in 2021 when we can celebrate these events in the manner to which we're accustomed in previous years. So we've made it through one more week, this one being week 7. And we made a lot of progress this week, but we have to make sure that we finish the job, and the job can be nothing less than conquering COVID-19. I know we can conquer it, and that is because I continue to believe, and every day has made me believe more in the people of Toronto and what they can do together to conquer this virus. So while the weather will be better this weekend, I know the majority of people will continue to do what they've been doing, which is stay home as much as possible and keep their distance from each other. Leave your house to go for a walk or a run or to walk your dog. That's fine and good for you and for your dog if you have one. But please just leave it at that. Thank you for your sacrifice. You are helping us save lives. You are helping us get through this faster and get to the day which we're preparing for very actively now, working with the province when we can reopen the city. I've used the term wartime speed a lot in referring to some of the things we've done with housing and other projects that have been done to give us a place where we can log our personal protective equipment and so on. I want us to get through the crisis at wartime speed. That way we can, as soon as it's safe, get back to Saturdays and Sundays the way we like them at this time of the year, real Saturdays and Sundays, having fun in our city. And on that note, I will ask Dr. de Villa to give her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. For today's update, as of 11 o'clock this morning, there are 5,687 people infected with COVID-19 in Toronto. This includes 5,135 confirmed and 552 probable cases. There are 351 people in hospital, 113 in intensive care units. In total, we have lost 369 Torontonians to this virus. On behalf of the team, once again, I extend my deepest sympathies to those who have lost loved ones and wish a speedy recovery to those who are sick. I've been asked to provide an update on the Jesse Ketchum Early Learning and Child Care Centre, which is one of the city's 7 licensed child care centres that provide care for the children of essential and critical service workers. To date, 6 child care centre staff and 1 child have tested positive for COVID-19. 2 children have tested negative for the disease. My team continues to work with Children's Services and Public Health Ontario to manage this outbreak. This includes reviewing the infection prevention and control protocols in place at these centres to see if changes can be made to prevent infections from spreading in these important centres. My team is completing a thorough investigation of all cases and their contacts to determine where they may have gotten their infection and to whom they may have spread it. This includes testing all staff and children who were at the centre between April 21st and April 28th. Staff and children who attended the centre during this period are required to be in self-isolation for 14 days from their last day at the centre. I also wanted to let you know that late yesterday, during a process improvement review, our operations team at Toronto Public Health learned that we did not conduct contact tracing for 52 positive COVID-19 lab reports received between March 31st and April 6th. I want to assure you that all 52 of these people were aware of their positive diagnosis at the time and appropriately isolated at the time. As such, there is no increased risk to our community and our population. This occurred, unfortunately, because there was an error in how these lab reports were received. Upon learning of this matter late yesterday evening, I immediately asked my team to take action to correct the situation. I also asked them to determine how this happened and to work to ensure that it does not happen again. I am committed to being honest and transparent with you, not only because you deserve that from me, but because this is core to who I am. You are all my patients, and protecting your health is my top priority. Earlier this afternoon, it came to my attention that there may be people calling residents in our community and falsely claiming to be from Toronto Public Health or being Toronto Public Health staff. In one instance that I just heard of, the individual was asked to provide their banking information and their social insurance number. My team would never ask you for this information because it is not relevant to our work. If you receive such a call, please do not share your social insurance number or financial information with the caller. Please instead contact Toronto Police Service to flag this matter. When a member of my team contacts a resident in follow-up to COVID-19 or a communicable disease, we would only ask you for information to confirm your identity and questions related to your health. If you have questions about a public health call, please contact our Toronto Public Health Hotline at 416-338-7600. In closing, as you've heard and as you likely know, we are anticipating nice weather this weekend. While I know we will all want to be outside, what continues to be best for our community is to stay home as much as possible and to continue to practice physical distancing. Now, this doesn't mean that you can't go outside at all. What I'm asking for you is to limit your outings and to make sure that you are being careful about practicing physical distancing when you do go outside. This is the best way to protect yourself and everyone around you. We need to continue our fight against COVID-19, and we need to keep doing what we can to reduce the spread of this virus in our city. So please continue to stay home, stay safe, and take care of each other. I'll now hand it over to Chief Pegg.
Thank you, Dr. de Villa. Excuse me, and good afternoon. I'd like to begin my remarks this afternoon by acknowledging that Mayor Tory declared today as both First Responders Day and Doctors Day in Toronto, and thanking him for doing so. In my role as Fire Chief and General Manager of Emergency Management, I have the privilege of witnessing the service of our police officers, paramedics, firefighters, communications officers, and our healthcare professionals every day. Each and every day, our first responders and healthcare professionals give their all in service to others. This may never have been clearer than it has been during COVID-19. I extend my sincere personal thanks to each and every first responder and healthcare professional in our great city, both today and every day. Earlier this morning, Toronto Fire Services responded to a fire under the bridge on Glen Road near South Drive. This is in the Mount Pleasant Road and Bloor Street East area of Toronto. Upon arrival at this fire, responding crews confirmed that the fire originated in a makeshift homeless encampment. Sadly, during the course of operations, one occupant of the encampment was located in the area involved in fire and was pronounced deceased. On behalf of all of us, I extend my sincere condolences to the family, friends, and all those impacted by this tragic loss of life. The investigation into the origin, cause, and circumstances of this fire is ongoing, with Toronto Fire Services, Toronto Police, the Office of the Chief Coroner, and the Ontario Office of the Fire Marshal, who are all working together to determine how this loss of life occurred. This is the 7th fatal homeless encampment fire in Toronto since 2010, and the first since April of 2018. This is also the 33rd fire involving a homeless encampment this year, and the 190th such fire since 2017. Since the onset of COVID-19, the City of Toronto has monitored encampment sites and removed dangerous materials such as propane tanks. While there has been a moratorium on clearing encampments during COVID-19, the city's Streets to Homes outreach team have also continually been out, checking on people living outside and offering services such as housing options. On Wednesday, the city announced a new program that is immediately housing people living outside, with the availability of 125 units in 2 apartment buildings in Midtown Toronto. As of yesterday, 47 people have moved into units with 24/7 staff support, security, and case management, focused on long-term housing and other immediate needs, including harm reduction supports. This interim housing is a bridge to more permanent housing options. Encampments where individuals are offered this housing will subsequently be cleared based on existing protocols following the offer of housing. This afternoon, I learned that some people are encouraging those experiencing homelessness to move into encampments for reasons I simply cannot fathom. This advice places the health and safety of our residents at risk. There have been 190 fires in homeless encampments in Toronto since 2017, 7 of which have resulted in people losing their lives as a result. We are working hard to remove the risks and dangers that homeless encampments pose, and as the fire chief, I ask everyone to avoid providing this type of reckless and irresponsible advice that would simply place lives at risk. During yesterday's City Council meeting, the issue of our PPE pandemic stockpile was raised, and I would like to provide some additional background and information on this important issue. In 2008, Toronto City Council approved the creation of a pandemic influenza PPE stockpile. This inventory of PPE and related items was established over 3 years, between 2008 and 2010. This stockpile was designed to absorb an estimated 8-week influenza pandemic in Toronto. Since that time, although efforts were made to ensure that the stockpile remained current and in place, a number of items in the previously established stockpile reached their best before dates. Some of those items, such as hand sanitizer and influenza antiviral medications, expired and were removed from active inventory some time ago. However, much of the PPE contained in the stockpile continues to be serviceable and has backstopped our ongoing response to COVID-19. In the past, we had believed an 8-week stockpile would be enough, but COVID-19 has emerged as a much longer fight, which requires much more PPE than anyone ever anticipated in the past. This issue has been one of the top priorities for our COVID-19 Strategic Command Team. In response to these command decisions, Mayor Tory has already asked that we immediately begin to plan to build up our PPE inventory as we prepare the city for the potential for additional waves of the COVID-19 pandemic. I would like to acknowledge and thank our purchasing and materials management and emergency operations center teams for their tireless work in procuring and maintaining PPE throughout COVID-19. Our PPE levels continue to be stable. Our present inventory levels are as follows. We have a 41-day supply of N95 respirators, a 199-day supply of surgical masks, a 56-day supply of isolation gowns, and a 20-day supply of face shields, with a large order of face shields incoming shortly. In closing, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Just for reporters, just so you know, on the line we have Michael DeAndrea, who heads up our Engineering and Construction Services Division, Marianne Bedard from Shelter Support and Housing, and Paul Raftis from our long-term care homes. First question is to Matt Bingley from Global News. Hi, Matt. Go ahead, please.
Hi there. Good afternoon, Mayor Tory. I was speaking with a homeless outreach worker who said that the 125 apartments that are working to house those living in encampments is a good first step, but saying that there's so many people living in these areas that it's just a drop in the bucket. I'm just wondering if the city is looking at this model and considering replicating it in other buildings throughout the city.
We're looking at a wide variety of options. It included the modular housing, 100 units that were authorized by the City Council yesterday, which we're moving ahead with dispatch, so that those could be occupied by as early as September. We obviously have been using hotel properties as we can. We have a rapid rehousing program that is, I think, going to use upwards of 200 and some odd Toronto community housing units that were vacant, some of which were being refurbished. So we're looking at a wide range of options, plus the use of hotel rooms to make sure that people who are homeless are in healthy, proper conditions as best we possibly can.
And Dr. de Villa, on the contact tracing that failed to get done, did anybody look back after the fact and complete that work, or did it even make sense to do it at that point?
So because we actually knew that people were aware of their diagnosis and had appropriately self-isolated, there was no risk further to the community, and we just checked in, made sure that people were doing well, and we have confirmed that today. So I think what this shows is that even within the context of a global emergency, we can really understand why it's so important to do these quality improvement processes. And that I'm pleased to say that our quality improvement and process improvement reviews at Toronto Public Health are working as they should.
Okay, thank you. We'll go to Dave Ryder now from the Toronto Star. Dave?
Hi, first question for Mayor Tory. As I believe that Canada Day celebrations are the first major cancellation Toronto has that goes past June. There's lots of city recreation programs that I have to tell you in July and August, and lots of parents who in the past have relied on those. Can you tell us when we will know, or if you can tell us now, if those events, recreation events in the summer are going ahead?
I can't tell you yet about the summer camps for two reasons. First, we've been looking obviously at the whole situation with the pandemic and how it's unfolding and how the numbers are going, because it'll fit in like everything else with the considerations of reopening or continuing with programs that would happen in a better time health-wise, and we'll obviously rely on the guidance of our public health officials for that, as we have throughout. But secondly, we are also looking at, within that context, looking at ways in which we possibly could operate camps on some kind of a different basis, and we've asked the staff to do that. So, kids are kids, and if kids are going to be, if you're going to try to explain to them the context of physical distancing, good luck in some cases. So it might mean there would be a way to do a camp with fewer kids or with more staff or some other kind of model. So we're exploring that, I guess, always trying to make sure we don't cancel the camps unless we have to, but we should obviously have that information in the interests of those planning and the camps, those with children that might attend the camps, and those who would work at the camps as soon as we possibly can, and soon in any event.
Thank you. And my follow-up question is for Dr. de Villa. And that's, Dr. de Villa, with no vaccine on the immediate horizon, and I don't think any hope of sort of mass herd immunity soon, can you just address what that means for Toronto, even as we start to move back to some sort of phased normal as far as large celebrations? Can we have those until we have an assurance that this disease won't just kind of roar back into the community?
Well, as it turns out, that's an interesting question, but it's not one that is exclusive to Toronto. I think when we look at the circumstances around the world, we recognize that we are all grappling with this very issue. What I think it comes down to is that until such time as we get very effective and definitive treatments for COVID-19, and until such time as we have a vaccine available and actually implemented and used broadly to protect the population, we are all trying to figure out how best we can continue to live safely with COVID-19 in our community. So that's the work of our recovery and rebuild team. I don't think that that's something that's exclusive to Toronto, and you can be sure that we're speaking with counterparts all over the world to help inform our efforts in this regard.
Okay, thank you. We'll go to Mark McAllister from City News. Mark?
Thank you. I have no questions. Thank you.
Okay, thank you, Mark. Final question then is to Beatrice Vaisman from CP24. Beatrice?
Mayor Tory, my question's for you. I know you've been working hand in hand with the province and the Premier in terms of developing a plan to reopen the city without committing to any dates. We saw the province at least put forward a framework to begin reopening the province. What kind of work is going on behind the scenes right now to make a plan to reopen Toronto? And when can we expect to see that plan, that framework for reopening revealed?
Well, first of all, our objective, if at all possible, taking into account there are some differences, obviously, with the biggest and densest, most densely populated city in the country, our objective is to have our plan follow along with their plan to the greatest extent possible, because it's less confusing for people, and it just makes sense to do that. Secondly, we are working hand in glove with them to the maximum extent possible. So I'll give you an example of that. They announced the opening up of community gardens, which we welcomed as a city, but we then had to work out the guidelines, which have been very actively worked upon by our public health people, by our parks and recreation people, and a host of others, such that we can have news on all of that available and have those gardens open to the public very shortly. And of course, now that they've made some other announcements today of a period of preparation that's allowed for different kinds of businesses, marinas, golf courses, garden centers, and so on, we will continue to work actively with those businesses and with that government to make sure that what we're trying to do is consistent in the interests of public health, but also getting the economy open up as soon as possible. In the case of the golf courses, we've been doing what we have to do to keep our golf courses kind of organized during the time when they've had to be closed, but we're now, like everybody else, as the owner of, I think, 5 golf courses, able to move forward and do the preparation, waiting for the good results to come on the tests and whatnot, so that we can open those up at a time that passes the threshold that Mr. Ford also had in his plan. So we're trying to work with them on everything we can, plus we're doing all of our own work to have our own plans that are unique to Toronto, such as how our transit system, for example, is accommodating the circumstances of an opened up city, and a host of other things that are unique to Toronto.
And my second question, Mayor and Dr. de Villa, you can both comment if you'd like, but I'm wondering, of course, we've had some pretty mild days already. This weekend set to be a beautiful weekend. You both touched on it in your opening remarks. We've heard a lot of hope in the last few days, both from yourselves and the Premier, that we're turning a new leaf and the situation slowly getting better. How worried are you, though, that people are going to take that hope and turn it into a cue that it's now a little safer for them to be outdoors? And just as a secondary question to that, too, how about now potentially even going up to the cottage to spend a glorious weekend up at the cottage?
I think the Premier and a number of the municipal leaders outside of Toronto have discouraged people from going to the cottage just yet, because there's a whole bunch of reasons in terms of the spread of the virus and in terms of stresses and strains put on local infrastructure there, both health and otherwise. And I hope people will, by and large, heed that advice, those that haven't been sort of staying in put in parts of the province other than Toronto so far. With respect to the fear of people backsliding, as it were, I think people got the message. I think they're so anxious to have this city opened up and to have Saturdays and Sundays with good weather and bad also able to be days in which you can go to a bar, go to a restaurant, go to a movie, go out for a walk in the park without any restriction at all, that they're going to apply maximum cooperation. Will there be a few people who don't? Of course, there's a few people who don't go along with any collective effort that we make on things, and that's just what you have to accept. But I think people will really more than ever this weekend understand that they have to be a big part of the solution that gets us to the promised land and gets the city opened back up so we can enjoy what I described earlier on as real weekends coming up in hopefully not too distant a time.
Okay, thank you very much. That concludes today's briefing. We will have updates over the weekend with respect to case counts. Stay well, everybody, and we'll see you on Monday.